The vision for this program was really all about students. We are an environment where we like to have people here learning, and the opportunity that we've had to work with Madison City Schools has just been outstanding to me.
It was through this program that I was able to see exactly what it meant to be in the medical field.
The MHAP program really gave me a chance to explore the hospital setting.
It's opened me up to so many more opportunities and jobs within the healthcare field. It's really rewarding having the opportunity to help shape the future of healthcare.
My favorite part is getting like a wide range of skill sets by going into different departments, like ranging from surgery all the way to the kitchen.
It really made me find my passion of what I want to do in life.
That helped me with skills that you can't really necessarily be taught in a classroom setting.
It gives us the opportunity to invest in the future of healthcare.
Actually, this was one of the greatest opportunities that I could have been blessed with in my high school career.
At first, I felt I was really dedicated to doing family medicine, but after realizing like all these different departments that we shadow and how each one, they're all important into treating a patient, I really felt that I wanted to make an impact through the hospital setting rather than an office setting.
My favorite part is just all of like the staff at the hospital. They're just so eager and helping you understand and like learn and grow from this experience.
My favorite part of the program is definitely interacting with the patients. Every patient's really different. Every situation you have to adapt and react differently.
I applied to the program because I really wanted a more in-depth experience into what the day-to-day life in the hospital is.
The one thing I like about Madison is how all the staff try to be friendly as possible and makes it a really comfortable environment, and I feel like that was a great opportunity for me to learn and to grow.
For the interview process, it was really intimidating at first. I was really nervous, but as soon as I met Miss Ellie and Mr. Andy, who were the interviewers, I just felt immediately at ease, and it was honestly really helpful because it was good practice for like when I do have to go in for a real interview for even just nursing school, medical school, just anything really.
I think while I was at Madison Hospital, I learned a lot to start off with. It's thinking back on it now, it's a lot more than I went in with and I left with. It was crazy. I really enjoyed being able to see the surgeons work and that level of expertise, which is otherworldly, the knowledge that they have. And then also me being able to see, go in there and see like, hey, there's a CRNA doing it, anesthesiologist looking over the CRNA, surgeons in there. It was a big change, and it really helped me, I guess, get an idea of how everyone works together, getting a procedure done like that.
What sets the program apart from other programs is that we are able to see the day-to-day of what it's like. We see the slow days, we see the fast days and busy days, we see the good and the bad days as well, and as well as the patient connections that we were able to make because we were there every day was really meaningful, because this is truly what healthcare is about, the patients, and being able to connect with them, hearing their stories and seeing their progress. And that really confirmed to me that the medical field was my calling.
One of my favorite parts of the ambassador programs was all of the people that I got to meet. I got to meet all these people from different stages of life and different situations and with different perspectives, and I thought that was so cool. I got to sit down and have these one-on-one conversations with people and just ask them for their advice. And then I also got to come into college with a better knowledge of what I wanted to do with my life. I kind of learned what I like and what I don't like within the medical field. And then also I got to work at Madison Hospital for 8 months. I got a lot of job experience, and I was able to make some money for tuition, and that was just a great experience for me. For me, it was just, I wish I could have done it for the entire 4 years of my high school.
These students come with so much excitement, curiosity, enthusiasm, and it gives us the opportunity to mentor them while they get hands-on experience.
We did a fundraiser at the whole year. We planned a fundraiser, and we wanted to try to raise money for a cause, and then also for the group itself. And so we ended up doing a candy cane hunt, you could say, like an Easter egg hunt, but for candy canes. And I learned a lot about like the business side of running a fundraiser for one, also like a nonprofit hospital, and how I guess some difficulties that you could have with getting money. And then also working with my peers, my other ambassadors, is a big leadership and communication skills I think I gathered.
The program is only going to grow, and the amount of influence that it reaches will only grow, and I just can't wait to see who else's lives are changed by this program, and what more this program can do for students like me. And they're truly growing the next generation of students in healthcare.
That's what we wanted when we opened this hospital. I wanted the chance for our students to be here. If they have a goal to be in healthcare, to be in, anything when it comes to food services, anything that we can possibly let them learn, Madison Hospital, that's what we wanted to do. We wanted to give them that chance. It takes a lot. It takes a lot for them to pull things like this off, to programs, and they went right along with us. When we met with them and when we introduced this concept, they didn't hesitate. They jumped right in. They felt like it was something that their students could thrive in this environment, and it's just been a true joy to see it come to fruition. I think if a program like this had been available for me, it would have made a tremendous difference, because it would have helped solidify that nursing was what I wanted to do. Healthcare was where I wanted to be, and it would have opened some doors for me that probably would have been beneficial. It's one of those things I want us to continue to grow the program. I want it to continue to evolve. I want parents to know that we are interested in their children. We are interested in what their futures are going to look like, because they're the future of healthcare too, and that's what we need. We need students that are passionate about being in healthcare.